work session, I guess, for for May 9th. So we'll call the meeting to order. And do we have any committee business?
Maybe just a little bit of information for you. So in order to get out to the restroom, you'll notice there's badge access, but if you go out this back door, Michelle or Kevin can let the committee members out if you like, or somebody can hold their badge up. So restrooms are right out this door. There are snacks and drinks on the tables that had dinner the other evening, so if you want to slip out and grab water or a snack. And let's see, you do have some materials that we handed out. So agenda for next meeting. We also gave you some answers to questions. We also gave you the question log that's been requested so you can see what's been asked, even if it's still in progress and you don't have answers yet. Maybe a note on the questions that or the answers that you do have to questions. These have some questions related to mandates, which do get complex pretty fast about level of mandate versus level of county service, what's unfunded, what's funded. So we've tried to put some additional information in here overall, but just let us know if that raises any additional questions for anyone. Some of these questions did also hit the 15-minute rule, so that's been noted, where a department said this would take me more time to get this information, and so that's something for the committee to consider if desired. So not something you have to take up, but if there was desire for more information. We also have one department still working on answers, that's the sheriff's office, so you won't see any responses from them yet, but they are working on it. We wanted to get you what we had. And then the information about the sub-fund, the general fund sub-fund that I mentioned is here as well. So that's what you have in front of you.
And we would take that up on Tuesday then, is that correct? If there's additional...
If there was a request to get additional information that exceeded the 15-minute, yeah, you could take it up anytime under committee business.
Okay.
Yeah.
Okay. Thank you. I guess we'll jump right into Health and Human Services, and I assume you had someone else. I kind of heard you over talking. You were going to have someone else present, I understood. So
I will turn it over to Zach Evans, our Administrative and Finance Manager, and he can introduce the next speaker from there.
Thank you. Sounds good. Thank you. So we are joined. We have Lisa Willis, we'll talk Assistant Director and Federally Qualified Health Center CEO. We'll talk about the overview of the FQHC. Suzanne Roloff, Community Health Center Manager, is here to talk about community health centers. Jocelyn Warren, Public Health Manager in Public Health, and Kate Budd, Human Services Manager, to provide an overview of those sections when we get there. So back in October, when Health and Human Services started our budget planning for this year, we set out with 3 goals. We were looking at financial stability within our funds, financial stability within our divisions, and every fund preferably structurally balanced. As Christine showed earlier this week, we're not quite there yet, but we are working towards it. We also had several objectives that shaped our budget development practice. We were looking at maintaining current service levels where possible, while acknowledging the decline in our American Rescue Plan Act and COVID-era resources. So keeping in mind that our federal and state dollars that were associated with pandemic response are waning. We're also looking at keeping our one-time resources for one-time projects, so such as capital purchase improvements or mitigating kind of long-standing or COVID impacts, but not focusing on reoccurring costs. So with that, we tackled the salary savings or vacancy variance. We targeted those towards each one of our areas specifically. We also mirrored the general fund percentage reduction, so hoping to keep our costs down that way. Last summer, we started a vacancy review process where every position that was coming up that was vacant would go through a review to see if we would post it again, hold it longer, delay, or potentially consolidate some work for savings. That process is working. We are definitely seeing the salary savings targets for this year that we set out. We also looked at deleting any vacant positions that were over 6 months old that have been vacant for at least 6 months. In January, we eliminated 13 positions that were estimated about $1.3 million. We expanded our zero-based budgeting practices this year, which in simple terms is you start from zero and then justify each expense moving up, actually tying it to a specific contract, a specific conference, and we've started to see that work a little bit in our travel and training requests. And then finally, we further looked at our space utilization and are going through an active, very robust space review. We have reduced one lease for office space going into this next year to kind of consolidate our teams, and with a hybrid environment, sharing more space. And then, not as kind of exciting as those, we've looked at all of our kind of technology, our laptops and cell phones, and are actively going after reducing our cell phones out there to save M&S dollars as well. So with that too, going into that kind of light, we approached again this year as the next fiscal year as the same as this fiscal year, with looking at how we could use unrestricted funds in our community health centers to support the department. So that has continued with an amount to support our communicable diseases program. As you also heard earlier, that's dealing with the pertussis outbreak, as well as our Women, Infants, and Children program. The proposed amount for fiscal year 25 is $1.54 million. It's a slight increase from this year due to kind of inflationary cost increases. The goal is to continue that kind of support from the CHC to our other areas in the department to maintain our programming levels, knowing that we are in a period of rapid growth within the health centers with 2 new locations plus mobile kind of primary care working forward, as well as launching a new electronic health record. So we're going to need a period of stabilization to kind of settle down after these massive changes as we look toward the future. So the goal is to continue that support to other areas, knowing that we might see some fluctuations in the upcoming year. Then Lisa and Suzanne will talk more about the CHC and FQHC growth. As a reminder, last year that was listed in the county administrator, the budget manager officer, and the county administrator's budget message, that we estimated that there was approximately $2.5 million in ongoing general fund savings from last year from doing this kind of subsidy. So we're continuing that practice. So with that, I've mentioned who will present today. So we'll be hearing from, like I said, CHC, Human Services, and Public Health. Behavioral health will be next week. So when we're looking at our resources, so the general fund kind of ongoing support's about 2.6% of our operating budget, which is an over a 6% decline from the current year. Our major kind of funding, or I guess our major revenue sources, is federal revenue, state revenue, and fees and charges. It's there, and then overall total revenues have declined 5%. I think the story as well with our department's budget this year is it's really a tale of 2 budgets. We are seeing growth within the community health centers and growth within behavioral health, while also we are seeing declining resources in human services and in public health. So when we go to the next slide, where you see that our operating budget is nearly flat compared to this year. However, it is the tale of 2 budgets, because next week behavioral health will go through theirs, and you're looking at a 15% kind of increase in expenditures for them. The CHC is looking at a 12.5% in expenditures increase, and more importantly, with some of this growth, a 73 FTE increase since fiscal year 21-22. Well, compared to that, you'll hear from Kate and Jocelyn in a little bit. Human Service is seeing a 22% decline in total expenditures, while Public Health is looking at an 8.6% decline. So it's really growing resources in some divisions and the opposite in the other. So with that, I will turn it over. I guess any questions on that high-level overview? Okay, I'll turn it over to Lisa Willis for the FQHC overview.
Thank you, and thank you for giving me just a little bit of time today to kind of orient you to our federally qualified health center model, because it is a very large endeavor that we do as a county, and the services span a variety of divisions within the H&HS department, and not always encompassing all of the work that happens within that division. It may just be a program or two that is part of our federally qualified health center model. So I wanted to make sure to refamiliarize everyone with what those areas are that we are talking about when we're talking about our FQHC and opportunities and performance. So those are our primary care health centers, our community health centers, the behavioral health services specialty clinic, our Lane County Treatment Center, public health, communicable disease, and family child health. So those are programs within those divisions that are part of the FQHC. And then we do operate a 340B program, which is discounted prescriptions for our members under the FQHC umbrella. It's important to call out those areas because I do want to take just a moment to lift up some of the really great accomplishments of this FQHC over the last year, and I want to be able to acknowledge the input of all of these different programs in creating that success. Specifically, I do want to call out, since we're in a budget meeting, we received the 2024 annual report for cost growth trends for Oregon FQHCs just a couple of months ago, and they have published the results for the 2021-2022 cost growth year, and these are for FQHCs within Oregon. We came in at the lowest number that they produced. So the range was that we had some organizations that had shown a negative 5.7% in cost growth, and we had some organizations that went as high as a 13.8% increase. We were setting that mark at 5.7 decreased in cost growth. So we have really taken the charge of being really good stewards, finding ways to do things economically. We also have entered into alternative payment arrangements with a lot of our payers that changes how you're funded and also can change how you invest those dollars in the operations of your organization and how you deliver that care more effectively and potentially more efficiently as well. So I really want to call out that accomplishment that we're really setting a standard of how to do things with a high degree of excellence and at the same time really containing those costs. I think hand in hand when we're talking about really how we've been able to contain costs, we should acknowledge that we were also awarded and acknowledged HRSA for some national awards this last year around our quality, around our access to patients being above and beyond what they're seeing in other organizations, our patient-centered medical home. So at the same time that the FQHCs are doing a good job of containing their costs, they are also getting the national recognition for the quality of work that they're providing to our members, and I think that's really important to recognize with these individuals. I also want to take time to call out that the 1115 waiver expansion gives us an opportunity to collaborate with our other partners within the county to address non-traditional health needs like housing and nutrition. And in collaboration with like the sheriff's office in a way that offloads associated medical related expenses to an FQHC budget, which frees up funds in the sheriff's budget to allocate for patrol. So really looking for areas where our work overlaps, where the FQHC has an opportunity to have funding tied to those activities where the sheriff office doesn't. So transferring those expenses into an FQHC cost center where there's an opportunity to get reimbursed and out of the sheriff's cost center so that they have those dollars to reallocate appropriately for their needs. So really looking forward to that ongoing collaboration between the FQHC and the public safety health partners.
I'm sorry, did you say that was the new thing that you were doing or something that has been ongoing?
This is part of the expansion of the 1115 waiver. This is increasing opportunities for that work.
Thank you.
Okay, slide 2. So this is just a quick look at kind of who we serve as federally qualified health center. So just looking at kind of some of those targeted populations But while you have that information, I really want to focus on kind of that pivotal role that FQHCs play in providing healthcare to our communities, especially those that are the most underserved. FQHCs provide an access to really comprehensive care that you don't always see in other settings. We provide medical, dental, behavioral, substance use. We have preventative, all housed within the same organization, which gives those engaged in our care incredible access to the full scope of services that they need to be a healthy person. We create affordable health care. We have a lot of financial resources that allow us to provide care to those that have financial barriers receiving care elsewhere. It is our design as an FQHC to be funded to be able to serve those as a safety net clinic in the community. And we can do that by focusing on prevention and wellness. That really helps increase the affordability of care. And we can do that through our capitation arrangements with our payers, because again, we are looking at being paid in a non-traditional way so that we can think outside of the box in how we deliver our care to the community most effectively.
Lisa, can I ask you a question? Patient population is approaching 30,000. How many people is the patient population so that we know how many people the percentages might
We
represent?
have seen fluxes. Prior to COVID, our population was really close to about 29,000. We saw the decrease around COVID. We're back in about 26, so we are on our way back to pre-COVID numbers.
And I assume there's 7 different types of category here, age
Yes.
one, and so they're duplicated, right? One person could land in one age
Absolutely.
category and all 6 of the others, or just 1 or 2 of the others. Or
Absolutely,
Thank you.
yes. And I think that brings back that community engagement piece. It's really important that as an FQHC, we are uniquely positioned to have those connections with our community members and with individuals that are within our clinics as employees and there to support, as well as members of the community. We have an opportunity with our health council to really query not only our customers, our consumers, but also community members about what is needed. We are uniquely positioned to be able to hear and pivot what we are doing in terms of service delivery based on the public feedback. And that's not always possible in kind of a private sector setting. And then I think another really important thing to call out is the economic impact. FQHCs contribute to the economic vitality of the community. They create jobs. They create a healthier workforce through providing the medical services that allow others to work in other organizations. And they create kind of that overall reduction to health costs, which allows the community to invest in social services beyond just that physical health or mental health component. So I think those are some of the ways that the FQHC is really an integral part of the success of the community and really a great kind of feather for the county to have in their hat in terms of something that they're supporting. Slide 3. And then just take a few minutes to orient you on our basic service-based funding sources. And so we do receive an annual base grant from HRSA, our federal grantor. That is about 10% of the budget. Otherwise, we are funded through alternate means. So most specifically, most of our revenue is generated from Medicaid payers like our Pacific Source and Trillium contracts that are capitated. So we are managing their memberships on a member basis and not a visit basis, which again allows us to be creative and innovative in how we care for that population. We also have capitation payment from the state, so that is helping to support primary care services at that state level. And then we still have some fee-for-service that we can bill for through our commercial plans. We have what is referred to as a prospective payment, which you may also hear referred to as RAP, which is an enhanced state payment that is provided for behavioral health, prenatal, and dental services in our FQHCs. We also have 340B revenue, which I will just take a moment to say is an ongoing concern based on how the administrations are valuing FQHC funding and the sources for that. And 340B program has been evaluated year over year, and we have not yet seen a disruption. But in collaboration or coordination with the challenges with pharmacies continuing to partner to provide access to 340B medications, this is a problem both at a legislative level in terms of supporting the program on an ongoing level, and then just an ability for our members to really access the program because of a reduction in their ability to use the pharmacies appropriately. And then just calling out that we do have an opportunity within the FQHC to bring in more revenue than we are required to operate. And so we are actively looking at ways to leverage that and to the point previously, to help alleviate where some of the other divisions in our department are needing additional support through general funds. We are trying to find ways to generate that revenue internally and be able to provide that support within Health and Human Services. Questions? Yes, Commissioner Lovell.
Thank you. It's a great presentation. It was really simple to understand. I just kind of from a high level, just overview, you talked about costs and expenses and recoveries and all that. Is there like just a generalized percentage of how much costs you recover versus your expenses, just kind of overall from the whole program kind of perspective?
I would want to get information to get back to you on that. I want to understand the question because there's a lot of costing that happens, and I want to make sure I'm giving you the answer.
Yeah, I mean, if just some CEO was coming in here to take over the whole program, his first question would be, all right, how much are we really recovering versus how much are we expending? So it's just a basic overall condition of how much we get back for what we put out.
Right. I do think we have to dig into that because our funding is so, it's not tied to direct services, it's tied to your membership and the health of your membership and the utilization of your membership. And that is tracked both within our organization to say, this is what we're spending, this is what we're getting back, but also components that affect the health plan that then create incentives later on if there are health savings based on the better management of our assigned membership versus maybe what another organization is doing. So our membership is costing the health plan less, and they can evaluate that and assign monetary amounts to that. So it's kind of a moving number.
And in terms of historically,
Yes.
different parts of the FQHC have different financial pictures. The CHC is really, and Lane County Treatment Center are the two revenue generating portions of the FQHC. CHC has a margin of $3 to $4 million a year.
Yes.
And LCTC has a margin of $2 to $2.5 million a year. So we use those margins to help support Family Child Health, and now Family Child Health is currently receiving general fund support, but they run at a loss within the FQHC. And behavioral health runs at a very significant loss, primarily because of unfunded and underfunded state mandates. And we are in the process of figuring out how to close that gap over time, because the reserves and resources we are using to close that gap today are not going to last for that many more years. So behavioral health, we are okay right now, and that's what we will present to you. But projecting forward, that's a big area of concern for us in terms of the financial wellness of the FQHC. So hopefully that gives you kind of that general overview.
Sort of. You're hitting the right trail. Just keep going, please. Yeah, I mean, maybe the follow-up question would be, and maybe this is kind of outside the spec of where we're at, is that behavioral health gap. Are we seeing with some of the new ideas with Peace Health and partnerships that gap could be closed in a better way without us having to be burdened for it?
No, I mean, Peace Health has CCBHC.
What's that,
And they,
CCBHC?
so oh gosh, Pauline's gonna be able to help me with this. It's a medical home for behavioral health, essentially, and receives enhanced payment for outpatient behavioral health services for complex populations, and they also run an inpatient unit. But none of that is duplicative to the work that we do or that we are mandated to do as the community mental health provider, or in terms of the other services that we're looking to offer in the realm of mobile crisis or stabilization center.
Other questions?
All right.
Who is up next? Oh, Community Health Centers is up next, what it says.
Hello. My name is Suzanne Roloff, for those of you that I have not met. I've been now at the Community Health Centers for 2 years, so I think this is the second year I've gotten to present the budget for you. Community Health Centers are celebrating 20 years this year, so we have been part of the community providing primary care services and additional dental, some of the other things that we've already mentioned over the last 20 years. So our vision is to improve our health and wellness of the community through the access to affordable holistic health care, which we've already talked about a little bit. Our budget for the proposed 24-25 year is just over $56 million, with planned expenses a little bit over $54 million. Next slide. As others have already mentioned, we are in a massive state of change right now and growth. We have 2 clinics opening this year. One, of course, is the South Lane Clinic, which has been under development for 17 years. We're so excited to finally bring that over the finish line in late summer, early fall of this year. It is under construction. If you drive by, there is lots of activity happening down there. In preparation for that, we have sent our mobile van in partnership with our public health department. And our mobile van is going down there twice a week to provide primary care services to the community in Cottage Grove in preparation for opening our clinic later this year. The West 11th Clinic, I know we've come before you a few times already this year in expansion. This was a result of the closure of the UD and the opportunity to assume the lease over at the West 11th Clinic that Peace Health has vacated. And that clinic is rapidly underway. We are anticipating a late June opening. We received our HRSA application approval a few weeks ago. That was a big barrier we needed to get past. Can't provide services until we have HRSA saying, yes, you can. So we do have that now, and we have 2 providers planned already, with a 3rd arriving in the fall. What else is up there? Oh yeah, this week. I might be a little scattered. We went live on Epic on Tuesday. So we are in day 3 right now of our Epic Go Live. For those of you that don't know, Epic is electronic health record. It's replacing NextGen that we've been on for about 10 years. That is throughout the FQHC. I cannot understate the massive undertaking that an electronic medical record conversion is. If you think of every little detail and piece of work that our staff do on a daily basis was ripped out from under them and given them a whole new process on Tuesday. Outside of taking a blood pressure and giving vaccines, which stays the same, everything else in their world has shifted this week. It's going very, very well. I'm very pleased. We did delay the go live by a week just to ensure that we had the staff have enough time for training and working in the practice systems. That was invaluable to our success this week. Our partner is OCHIN, and OCHIN is an organization that's nationwide that partners with a lot of FQHCs. So we're getting years and years and years of experience from the OCHIN team of FQHC work, which will help us as we move forward into the stabilization phase, which will be over the next year. But the benefit to the community for Epic is tremendous. We'll have a very, very robust patient portal, finally, where folks will be able to really have direct access to their providers, communicating messages, asking for refill requests, checking in on their lab results without having to call in and get a copy of them. We're really, really excited about bringing that to everybody. And those are our big changes this year. Really focused on access and our growth. We are looking, I think our estimate goal we set of 4,000 new patients, which of course we set earlier this year, is underestimated, considering we are now adding 9 PCPs, and I just received a text today from another one, so interested in joining us. So we have several folks that are interested in joining, and this one's for Cottage Grove, so I'm very excited about that. Our Cottage Grove clinic does have 2 providers already that we have permanent coming in, and hopefully this would be a 3rd. Next slide.
And dental, right?
Yes, our clinic down in South Lane will be our first full-scale dental clinic, and our West 11th clinic is going to expand into radiology and having x-rays for our patients, which has been a barrier for care for folks for a long time. We don't have x-ray currently, and so when you need that, you've got to go someplace else, and that can be a challenge for some of the population that we serve. So our main focus over the year is really focused on Epic and making sure that we get all of those kinks worked out. Radiology services, South Lane, West 11th, and throughout it all, really maintaining our quality metrics. That's a source of revenue for us and savings for our CCOs. We want to make sure that we continue to provide high quality care. Our West 11th clinic has some specific goals that I've laid out for the teams to decrease the utilization of the ERs. That's part of what we're trying to do and looking at some creative ways to do that. Our mobile van, looking in partnership with public health at what that might mean. Maybe our primary care providers will go to the shelters or to the navigation center or work out in some other rural areas where maybe there isn't care. Now that we have that pilot working pretty well, we're looking to see how we would expand that in the 24-25 once we get past all of the Epic hurdles. Throughout that too, as we're looking at our different areas, we're looking at our bilingual needs. There is a community in Cottage Grove that is unique, that has some unique bilingual needs, and so as we expand, we'll continue to look and see what other services, what other languages we might need to offer. Stabilization year, rapid growth and stabilization. Of course, we're committed to our 340B program and ensuring that we continue to advocate for that, as Lisa mentioned. And we want to start to review our access needs on our commercial payers. We are open for Medicare and Medicaid, which is some of our fee-for-service revenue and Medicare. And Cottage Grove offers a unique opportunity. What are the needs of the community there? Are there commercial insurance needs that we need to pursue in that area? Are there other needs of the community that have access needs that the community health center may be able to help fulfill? So we'll continue to look at that over the next year.
Any questions for?
I have a question, if I may. Thank you, Chair.
Yeah, please.
Regarding radiology in West 11, the equipment for that, right? Where did that, how did you
Peace Health.
acquire that?
We've gotten it from Peace Health.
See, I was throwing a softball. I knew that was
Thank you. Originally, we were going to purchase, they were originally going to keep it, and then they said, hey, you know what, let's put that in the lease.
And it was granted as a part of the lease
Yes,
then?
it is
Excellent.
granted as part of
So that's a part of the coordination between us and Peace Health as they adjust their services locally. Bravo, thank you.
Can you just say a little more? I'm really intrigued by this transition of care and access team.
Oh, yes, our TOCA team.
Yeah.
So we started that as a pilot program last summer, and that started with one nurse working on our transitions from folks that were coming out of the hospital. There is certainly an incentive from the insurance companies to ensure that patients are not readmitted back to the hospital once they've been discharged. And that can be a recurring cycle for a patient. So our TOCA nurse specifically makes phone calls to all of our discharged patients that are assigned to us and works with them to ensure that any of their home health needs might be met, any DME needs are met, do they need any follow-up with their PCP, and ensure that they have what they need before getting in to see the primary care provider. You might not need that immediately after discharge, maybe that's a few weeks. And that gap of that few weeks is when readmissions mostly happen, and so the TOCA team is helping to prevent the readmissions.
And is that a place where there's, not sure how to phrase it, overlap, cross-referral, using the 1115 waiver, where some of these folks, I would imagine, if they're medically compromised, it's harder for them to stabilize and get well if they're unhoused or.
Exactly.
So is that a place where a lot of that?
It's definitely a place where we could expand that. So we have recently expanded that in the last few months. We were able to hire a few more nurses. Most of them are part-time, so that we can serve more we have not been able to serve all of our ones that are discharged from the hospital yet, but we're getting really close.
And we're working with both hospitals?
Yes.
And geographically, as far as where people are being discharged to, there's no barrier as long
No.
as they're within Lane County?
Yes.
Great, thank you.
If, at the ones that are assigned to us.
Yeah.
Great question.
Other questions? Thank you very much.
Thank you.
Next.
And Chair, with apologies, I'm going to be leaving for about 17 minutes. So
2 minutes, start and stop.
it's a very exact time.
It's okay,
Okay, we're
you know
watching.
all of this stuff.
I've been watching.
We're gonna watch Pat right now.
Well, good afternoon. My name is Kate Budd. I'm the Human Services Division Manager, and I've been in this role for a little over a year and a half, but I've worked with the county for an additional year longer. Human Services Division has an extremely wide scope of supports that we provide to our neighbors across Lane County. Includes helping people remain stable in their homes and increase their income so that they are no longer experiencing poverty, to helping folks who are at risk of losing their homes and becoming houseless to remain in their homes and increase their stability, to helping people who are houseless be able to move into shelter and permanent housing so that they are no longer without a home and they stabilize and remain so. We do this through a wide array of different programming, which includes prevention rent assistance, housing-focused street outreach to folks who are houseless, emergency shelter, as well as rehousing programs that move people from shelter or the street into permanent housing. We also provide utility bill assistance and weatherization supports and rent assistance to folks who are in homes and experiencing a low income and maybe unstable in their housing. We also have workforce employment and training supports that help people who are housed in low income or in any type of income situation, as well as those who are unhoused. And then we also have a robust veterans workforce program that helps to support veterans who are needing to get back into the workforce, as well as a veterans service officer program that helps veterans access the benefits that they're eligible for. We have a total of 60.48 staff members as we're looking at the next fiscal year. This is a reduction from this current year because we have the Dovetail Care Coordination Program transitioning from HSD to the community health centers. While we will miss them, we know that this is an important stabilizing change for them to ensure that they are fully funded and able to remain a support in the community. Among the resources that we have, next fiscal year we're looking at about $48 million, and then we'll be expending approximately $47.7 million. Regarding the general fund ask, approximately 16% of that ask is focused on veteran service match, which is a requirement to be able to bring down state funding for that work. About 74% of the general fund ask is for houselessness and community action work. Over 90% of those dollars are used as leverage to be able to bring additional dollars in the community, whether it's locally at the state level and also at the federal level. Excellent. So a number of changes that we are looking at for the next fiscal year. Firstly, a notable reduction in the overall amount of resources due to COVID dollars waning significantly. We will have a small amount that's a part of the fiscal 25 year budget, but the vast majority will be gone at the end of this year. That will result in fewer contracted programs in the community. I had the opportunity to share those specific programs with the commissioners earlier this week. We also saw a positive change with the governor's executive order, all-in funding, which started last fiscal year, and a round two of dollars will receive this year and will move into the next fiscal year. Those all-in dollars support specific facets of our homeless response system, including prevention, rent assistance, street outreach, emergency shelter, and then rehousing programs. We are receiving those additional all-in dollars as well as other dollars from the federal and state government. And what we're finding is that the dollars are much more complex. They're very prescribed, and so the level of staffing that we need, very much is remaining stagnant simply because we need staff to be able to provide technical assistance and training to the agencies that are offering these much more complex and guideline-laden programs that we are receiving, particularly from the federal and state government. And then we also reorganized this year, and as a part of that reorganization, we did reduce the overall number of supervisors within the department, and instead utilized the supervisory positions for more direct service work, particularly as a liaison between our nonprofit partners and the county, making sure that the guidelines are being followed for the programs. So here's another view regarding our programming in the community. Again, we very much focus on stabilizing supports, hoping that people in the community will not destabilize and lose their housing. We're well aware that it is much more expensive for someone to lose their housing and become rehoused than it is if we just simply support them in their housing today. If someone becomes unhoused, we have a number of supports that meet the basic needs of people in the community. And then we also have a number of programs that help move people from houselessness, whether in shelter or on the streets or in cars, into permanent housing. So I think our most significant challenge going into next year is just very much the reduction in funding that we are dealing with. As I'm sure all of you are well aware, the need continues to remain very high in our community among those who are houseless, as well as those who are just unstable in housing or couch surfing or doubled up with friends or family. We are going to be seeing a reduction in the overall number of programs available, such as street outreach, emergency shelter beds, rehousing programs. We're also hearing loud and clear from our nonprofit partners that they too are very much struggling to meet their budgets for the next fiscal year. We were fortunate with the COVID dollars, and many agencies grew and grew quickly, and so unfortunately their infrastructure wasn't able to grow at the same level. And now they're having to shrink back down to the more regular, consistent funding that's available, and that's a struggle. And so recognizing that our nonprofit partners are asking for more dollars, and unfortunately we just don't have them available. We're also seeing that there are very strong partnerships within our local community that help to increase the effectiveness and the efficiencies of our programs. The Human Services Commission is a great example of that, where we are bringing together dollars from the City of Eugene, Springfield, and Lane County that very much are the most flexible dollars that we have in order to help fill in those gaps, and particularly to be able to meet match requirements that come in from the federal, the state, and the local partners. And so we're very fortunate for the Human Services Commission flexible funding, and that is a part of the general fund ask before you today. Regarding opportunities, we continue to look across our cadre of Human Services Division programs and see how we can work more closely and effectively together, recognizing that often for someone to stabilize, they need pieces of employment, maybe veteran services support, maybe community action supports. And so we've been able to break down pretty significant barriers to create programs that might offer someone employment support, housing support, as well as weatherization support all at the same time. We were also fortunate that HUD chose to combine our Continuum of Care application, which we've been receiving for a long time, the programs awarded through our application, with our Youth Homelessness Demonstration Project programs. And by them being combined to a total of nearly $9 million, it increased our ability to receive planning dollars from the federal government, because it's basically based on percentage of dollars received. And it also increased our ability to request additional programs through the Continuum of Care application. So that was a positive opportunity that we're going to be certainly taking advantage of next year. All In has been very positive and helped us to increase the overall amount of programming that we have available within the homeless response system. And we're very much pleased that the dollars will continue through the end of the next fiscal year. Medicaid 1115 waiver is a pretty significant opportunity that we have. There is a rent assistance benefit that's a part of that waiver that we're planning on applying to be a provider for. Certainly we have to make sure that the dollars make sense, but it just helps us to be able to expand our array of funding that we receive to be able to stabilize households.
When you say the dollars make sense, do you mean what we receive to administer the program and help folks who are eligible?
Correct.
Okay, great.
And then lastly, we have had a FUSE series of programs, and FUSE stands for Frequent Users of System Engagement, and previously had a SAMHSA grant through the federal government. That grant ended last year, and we're very pleased that we're able to continue the majority of those FUSE programs. And one of the primary reasons that's a priority is because the FUSE programs very much showed significant cost savings, because those being assisted are the most frequent users of criminal justice and health systems such as the emergency room or inpatient care. And so by focusing on those populations, providing them with basic needs, moving them into permanent housing, we were able to see significant cost savings to those other systems. And so we're pleased to be able to continue those programs into the next fiscal year. Any questions? Yes.
Just did want to catch you before you went to another subject. So how is that FUSE program being refinanced if we're losing that money?
So part of it is we're going to be able to utilize a piece of the All-In funds. And then we're also, as a part of the budget, those programs were prioritized.
So do you foresee in the future that may have to take a harder look, or we may be in some challenges even more than we're at now?
Correct. Exactly. Yeah, and we're looking at other funding opportunities. Fortunately, there are other partners at the table beyond just the homeless system partners, and they play a key role in keeping those programs funded, but we may need to negotiate further.
One more, Chair, if I could. This is going to be a really hard question to ask, and I'm going to ask it in the best way I can. Back to Lisa's slide, when we first opened up this discussion, there was a percentage of the people that we serve, and one of the higher percentages of people we serve were those under 18, 35% if I recall, versus 39% 18 to 49. So it's almost like at some point in the future I'm seeing, and I'm hoping I'm wrong, is that we're going to have to really swallow a bitter pill and refocus on our youth so that our youth doesn't turn out like what we're spending 39% with people over 18. Do you foresee that black cloud coming at some point?
So I can speak a little bit to the the mix of patients that we have within the federally qualified health center, a very, very high percentage of youth in our state are covered by the Medicaid program. And then the percentage of the population that qualifies for Medicaid decreases as people get older. And so what you see in terms of the mix by age in our FQHC is a function of the populations that receive Medicaid coverage, but that doesn't indicate that we have an abnormal amount of trouble in terms of that population that we serve, just that it's much easier to qualify for Medicaid when you are under 18.
Well, that makes the data a little more clear. Thank you.
Just to add additionally, we offer preventative dentals that are school-based.
I'm sorry, I'm having trouble hearing you. What did you say?
We provide preventative dental services that are school-based.
Oh.
So our demographics as an FQHC take into consider a huge population of children in the schools that we are providing preventative dental services to, so that does shift that demographic.
So then maybe the follow-up question would be, the black cloud's still going to be in the mid-range populace where Medicaid sloughs off and they're between 20 and 49. That's going to be still our focus going forward for the most part of percentages. Is that what I'm hearing now?
You know, we're starting the process of creating our next strategic plan for the Poverty and Homelessness Board. And that plan helps to guide us in how the dollars are allocated, especially those more flexible dollars. And so that will help us understand kind of who will be those priority populations moving forward. I will also offer that the state has made pretty considerable investments in youth programming in the last year or so, and they've chosen to fund those programs directly.
Wow.
And so we're not, the Lane County as the continuum of care and the Community Action Agency isn't receiving those dollars. And so our picture looks different than the kind of big picture of the overall amount of funding for a homeless response system locally.
I would say one other population that's really important to call out is that we continue to follow the nationwide trend here locally of seeing an increased number of older adults entering into houselessness. So that the percentage of folks who, and I just saw an article yesterday that said the health conditions of a 50-year-old who is houseless are similar to the health conditions of a 65-year-old who is housed. So when you think about older adult in a houseless population, really 50 and older is what you should be looking at. And we have folks who are more than 80 who are houseless in our community. So this is a population we need to focus on with the resources. We just haven't separated out older adults. HUD has not collected data on older adults until recently, and so we haven't learned how to really target and focus programming, and we're working in collaboration with some other agencies to explore that as well.
Last one, sorry. Have you had a chance to cross paths with a veterans organization called Reveille by chance?
Yes.
Okay. That's an
Yeah.
exciting piece. I'm just glad. That's the only question I need. Thanks. They're exciting folks.
Thank you, Kate. Anything else for? Thank you for all the clarifications.
Yeah.
Very much appreciated for, I mean, it's just, I just sit here in awe. I'm going, you guys do that too? Wow. But anyway, but thank you for the clarifications. I really do appreciate it.
Public health has more programs than anybody, so.
Okay, good, because I wrote it all out, so I don't miss anything. So, good, we were just clarifying how much time there was available for this presentation, so thank you. Good afternoon, I'm Jocelyn Warren, I'm manager of the Public Health Division. I've been in this role for 9 years now. So what unites all public health programs is the focus on protecting and promoting population health. So our concern is the larger community. Most of what determines people's health happens outside the clinic setting, in homes, families, neighborhoods, and workplaces. So the work of public health is to support healthy environments. In programs that deliver services to individuals, the goals are still population level goals. So for example, in the instance of WIC, the goals are to improve childhood nutrition in Lane County and prevent low birth weight. So we have a total FTE now of 104.65 and a proposed budget of the resources at 20 million and expenses at just over 23 million. We'll talk a little bit more about that as well. Next slide, please. Overall, public health is in a position of stabilizing. I think stabilizing is a word you're hearing a lot today. Following reductions in state and federal funding, reductions have impacted most programs either in the loss of FTE or reductions in materials and services, including supplies, training resources, and equipment. Overall, there has been a 26% reduction in FTE as compared with the 23-24 budget, and the budget has been reduced 20% from last year. At the same time, we are planning to launch a new program. Family Connects was mandated by the state legislature in 2020, but implementation was delayed by the pandemic. So this is a voluntary program for all families with newborns in the county. The program provides 1 to 3 visits from a nurse to support parents by linking them with community resources and providing guidance on nurturing their whole family and supporting their child's health. It is a much less intense program than what our current nurse home visiting programs are, and the way that the program's impact has been measured, it has actually depended on also having intense nurse home visiting programs available for referral for people who need additional support. The Pacific Source Community Health Council has provided a grant to support the launch of Family Connects, and by year 3, the program is expected to be self-sustaining through billing of Medicaid and private insurance. Finally, COVID is coming to an end, as we've noted several times today. The funding for public health had been extended a few times, but specific funding will stop at the end of this calendar year. Of course, COVID itself is not over, but it is no longer a reportable disease, and any outbreak response will be conducted by staff in the communicable disease program, who are very busy today with a pertussis outbreak. Next slide.
Where does Family Connects live in Healthy Families, Family and Child Health? Where?
Family and Child
Family
Health,
and Child.
yeah, are the home visiting programs.
Okay, thanks.
So just want to interject there, as budget planning is an iterative process, and with the changes with the Family Connects program, we do have a budget add for the committee's consideration to fully then get the FTE and the staffing needed, plus authority for the personnel costs, but also the M&S pieces here, which will be distributed now.
Okay, thank you. So key initiatives for the upcoming fiscal year are reaccreditation. We achieved national accreditation 5 years ago from the Public Health Accreditation Board. That was assuring our conformity with national performance standards. Reaccreditation focuses more heavily on continuous quality improvement, so that is the work we're doing this year. Public health modernization is the state model that the legislature has been funding since 2015, and we continue to implement that model at the local level in collaboration with other counties and our state partners. And I mentioned Family Connect, so I won't say too much more about that. Below is the photo of one of our mobile vehicles that we are collaborating with the community health centers and some other partners on to bring services out to the community. We've also partnered with other groups, such as Parole and Probation, to support their efforts in the community. And this year marks the beginning of our new community health assessment to inform the new community health improvement plan. The commissioners will be hearing a lot more about this effort in the next few months. This work is collaborative with many community organizations, our health system partners, and the CCOs. And then finally, Lane County now has a medical reserve corps, which was a big problem for us during the pandemic that we didn't. And we had to go through the state in order to request volunteers for our emergency response. Now we have our own volunteers, and we call this the Public Health Reserve Corps because it includes both medical and non-medical volunteers. And these are people also that have language and cultural skills that are critical in an emergency. Okay, challenges and opportunities. So in terms of opportunities, as we continue the work of stabilizing services in public health, we continue to advocate for additional state resources for modernization and supporting public health and health system transformation, especially with the long legislative session coming next. The environmental health program will be updating its fees and will be engaging operators and license holders in that process. particularly those who may be impacted the most by increases. That process will begin later this month. The community health assessment and planning process is, as I mentioned, an opportunity for the whole community to come together in which we prioritize health outcomes that are the most important to everyone and then work from a collective impact model to make substantial changes to support healthy communities. And then in terms of challenges, funding declines have meant losing core capacity in public health for responding to emergencies. We also continue to work with our partners to develop a sustainability plan for the mobile program that has been dependent on COVID and CDC funding that is ending. At the same time, we have emerging challenges to address, such as the opioid crisis, increases in syphilis, including congenital syphilis, which afflicts babies, is devastating and is entirely preventable if treatment is received in pregnancy. So prevention for public health, especially of acute emergencies, is where public health focuses our energy and resources, because I think that's where we would all want for our own children to be healthy and thriving and not need crisis care in the first place. And that's the end of my presentation.
Any questions for Jocelyn? Sure, Commissioner.
So what's required for us to stay accredited, and what are the benefits of it?
Thank you, that's a great question, I appreciate that. So there are standards and measures that are outlined in the Public Health Accreditation Board. It's a very thick document. I think most accreditation processes are very complicated. This is no different. So there, it goes through all of the foundational capabilities of public health. There's assurance functions, there are service delivery functions, communicable disease, environmental health is included as well. And also this community health planning piece is a really big focus of accreditation and what the expectations of public health are in the community. And we met those. That was when you, for that first accreditation, you have to supply, I think it was like something like 550 documents that reflect the work that you're doing. It took a long time. It was a big lift, but it was definitely worth it. What I think the value of accreditation is increasing the credibility of the public health department and confidence that the work that we're doing has been externally evaluated and found to be excellent. I mean, that's really what it comes down to. And we also, a thing about public health is that it's been kind of transforming since, really I think since the federally qualified health centers came into existence. Before that time, it was really public health that were safety net clinics. So starting from kind of into like the 50s, 60s, 70s, a lot of people associate public health with services to like indigent communities or something like that, and really safety net medical services. But with you have an FQHC model, you have somebody in the community who's providing those services, the safety net medical services, which are critical. And if you can then be able, as public health, to shift your focus, which should be on the larger community and thinking about healthy environments and policy and planning. That is the better role of public health, and it supports the efforts in the FQHC, and it just allows us all to be more successful in thinking about planful and prevention, and really put our effort around preventing issues and thinking about the whole community instead of just constantly in kind of crisis reaction mode. Thank you for the question. That was fun.
I will say we get surveyed and accredited in, I think, every single one of our operational areas. And I take great pride in that because it's an external demonstration of the quality of our work. And I think you heard in the earlier presentations how much we value that. And we value having someone come in and give us feedback, just like an audit. On the financial side, it's important. Otherwise, we can lose sight of what the best practices are.
Other questions? Comments? Thank you very much.
Thank you.
We get a short break now, it looks like. Is that right?
Looks like a short break.
Welcome back.
Got back in just in time to take a break. Don't leave in my account.
So you actually have a 20-minute break.
Yeah.
Really?
We went really quick.
time, some of you have. This used to be quite a dog and pony show, we used to call it in the Army. Talking about all the different services we provide. We've gotten to a more focused effort on this, and so we're just going to be highlighting 4 of our divisions to the sheriff fund to highlight some of the big changes, some of them good, some of them concerning, in our next budget year. So I'm Dan Hurley, I'm the Public Works Director. I have most of my team here in the room, and some of them are online. So we'll focus on those specific divisions, but we'll make sure to end early, or wrap up our part early, so that you can ask questions of the other divisions or any other questions you have. So these are the 4 divisions we will be focusing on today. Parks is our good news story. With the Parks Levy, we'll have over $31 million coming in over 5 years to catch up on a lot of our backlog maintenance and move some important partnerships and capital projects forward. So Brett Henry will be here to talk about that. Land Management Division is one of our concerns. Not a major issue at this point, but we are structurally unbalanced there. We'll be filling that with reserves. We had built up a healthy reserve there, not quite to our goal, but we will be dipping into that, and Keir will talk more about how we're trying to address that going forward. Road and Bridge Maintenance, we have Oren here. Did I say Keir Miller? Oren is there. And then Sasha Vartanian with Engineering Construction Services. These 2 divisions share our road fund. We have serious concerns about the road fund going forward. We're okay right now. Again, we had built up some healthy reserves, and we're intentionally drawing down reserves to move projects forward. But the long-term view for the road fund is not good, as gas tax has plateaued and likely to drop with electric vehicles coming on and better fuel efficiency for vehicles. So we were highly reliant on the gas tax and the state money we received through that. And hoping that there will be some sort of legislative fix, but we have concerns that that might not get us to where we need to go. So we wanted to highlight that as well. So here's a quick chart of our proposed budget and our revenue stream. And you can see here that we're reliant heavily on fees and charges, and those are specifically primarily in 3 divisions. So our Waste Management Division receives what we call tipping fees for the garbage that is produced. That's an enterprise fund, so that's self-sustaining. Fleet, 13.7 million there. It's an internal service, so the charge backs for vehicle replacements and maintenance. And then Land Management Division also heavily reliant on fees. Our Land Management Division is not supported by general fund, which is typical in other counties around the state, so heavily reliant on fees, and we'll be looking at fees going forward, needing some adjustments there. So that's the big green piece. The blue piece that you see there is the federal and state revenues. So again, we're highly reliant on the highway allocation. That's primarily gas tax, but also vehicle registration and some other pieces that are in there. We also receive quite a bit from construction reimbursement for projects that we carry out for ODOT and other jurisdictions, and I'm sure Sasha will go into more details on that. So that's more than 2/3 of our budget, and then lots of other smaller pieces there. We don't receive a whole lot of general fund in Public Works. That only comes into one of our divisions, General Services, and specifically for our animal services that we provide there. So we are making a small reduction to try to help the general fund and all the reductions that are needed there, and it's about 16,000, not a huge impact. We're trying to do our share in reducing the reliance on general fund. But we just don't receive enough income in pet licensing to be able to really carry that, so it requires additional support. And then looking at our expenditures, so down 11% from last budget year, and that's primarily due to capital expenses. So we have 15.5 million lower in capital expenses, and that's primarily because we had some large waste management projects that for cell expansion that had boosted our capital expenditures previously. But we have been able to keep our materials and services in check. Going backwards here, sorry. That's a $1.5 million reduction, which has been, I'm impressed that we were able to do that given the rising cost of materials that we're faced with challenges throughout the department. But our personnel costs are rising and are likely to continue to rise. So that creates that concerning issue with the gas tax declining and personnel expenses that will continue to rise. We've got a list there of capital expenses by fund for this budget year. Those will be primarily in the road fund. I think we have maybe 14 projects, maybe more, that Sasha will talk about in her presentation. And here I will pass off to Brett with Parks.
Thank you, Dan. So to advance, I arrow down. Okay, so Lane County Parks, we operate 66 facilities throughout the county. It's a pretty expansive geographic area from the Pacific Ocean to the Cascade Mountains. We operate 5 campgrounds, 3 marinas, 12 natural areas, 3 additional ones I want to talk about are water access sites, but 34 in total water access sites with 32 boat ramps. We also offer beach access at Florence at 2 locations, Cedar Beach and North Jetty Park. We have expanded our operations recently. Back in fiscal year 23, we had about 19 full-time employees. Now we're at about 29. And you can see our resources have grown as well from about $4.5 million in 23 to a little over 11 million. And that's primarily due to the passage of the local option levy in 2022. It is important to note, however, that this is a temporary bump in revenue and is directly dependent on voters renewing that 5-year local option levy in those 5-year cycles moving forward. The division has 3 operating funds. We have Fund 216, and that's our campgrounds, our day use areas, our marinas. We have Fund 217, which I'll talk about in a bit. Doesn't have a lot of funds in it, but it's for the 3 offline covered bridges that are no longer part of the road system. And then we have Fund 295, which is the levy fund. So, looking at some changes in this upcoming budget, we're significantly investing more in reducing our deferred maintenance backlog. The backlog is a result of over 40 years of insufficient funding for parks, and projects were put off for a rainy day and postponed, and now they're coming to roost. And in 2018, when I was hired, I knew that I needed to reduce that deferred maintenance backlog, which was going to be the first thing that I really worked on. So we had a assessment of our facilities, called a facility condition assessment, and that showed that in our 17 parks with the most built infrastructure, there's over $22 million of deferred maintenance, so that's significant. Fortunately, as mentioned earlier, the Lane County voters passed a 5-year local option levy in November of 2022, and the estimate is about $31 million over a 5-year period through 2028. Some scheduled deferred maintenance projects for this budget include replacements of restrooms. We did a series of public forums and meetings throughout the county, and folks said restrooms were number 2, actually, behind pickleball is number 1. And so, looking at Forest Glen and Cedar Beach, those are 2 restroom facilities that we'll be working on. Forest Glen Park, for those who don't know, is along the McKenzie corridor along the river there, and it was damaged in a holiday farm fire. We plan on doing a complete total replacement of the parking lot at North Jetty Park, So if anybody's ever been there, you know that it's the moon craters, right? So it needs a complete replacement. And then we're also looking at paving the North Bottomlands Park there at Mount Pisgah, at the, or Howard Buford Park. In 2021, we received about $4.3 million through the American Rescue Plan Act, or ARPA. I don't know if it has a new name now, but this funding is now contained in Fund 216, and it's dedicated again to reducing deferred maintenance. So we're looking at primarily 4 parks. We are looking at 4 parks: Armitage, Baker Bay, Orchard Point, and Richardson. All of those facilities have campgrounds and marinas, so there's a lot of water and sewer infrastructure that we're working on redesigning and replacing. So through 3 funding sources, the levy, as mentioned earlier, what was formerly ARPA, and through FEMA award that we got after the Holiday Farm Fire, we plan on making numerous improvements and repairs to infrastructure. In this budget, some planned projects include enhancing the safety of our parks. That's another thing that we heard in those public forums. So we're going to be adding some more security cameras. We've already added a few there at Pisgah. We're going to add more security cameras, and security services will be provided. We're also looking at adding more pavilions and covered shelters so folks can reserve at our parks. So one will be added at Eagle Rock Park, and that's on the McKenzie River. That's used quite often by the river guides and the fly fishermen. And we have off-leash dog areas there at Armitage, and we're going to add some covered shelters there as well. So an emphasis for this levy is improving access to our parks. And since I was hired in 2018, I've really tried to work on that, but I just haven't had the funding to do it. So now that I do, right away we're going to be repairing these marina docks. They're in poor shape, so just redecking and making those necessary repairs, as well as adding what's called universally accessible trails at Howard Buford Park. And so those trails will allow folks who have some physical limitations to actually be able to walk the trails at the park. This upcoming fall, we will be conducting an ADA assessment and transition plan, and this is to better understand and address any ADA or American with Disability Act deficiencies we have within our park infrastructure. Of note, last year we partnered with David's Chair organization, and we added a all-terrain motorized track chair at Aceta Beach Park. And so this allows folks who utilize wheelchairs to be able to experience, our amazing Pacific Ocean. And so we're getting a lot of compliments about that. And in this budget now, I'm proposing that we add 2 more track chairs, partnering again with David's Chair, but also the Arboretum and McKenzie River Trust, another local organization, there at Howard Buford Park in Eugene Springfield. And so our key initiatives, number 1, as mentioned earlier, obviously reducing our deferred maintenance backlog. We want to better achieve cost recovery. So we're going to take a look at our services that we provide and ways that we can be more efficient, and doing a full assessment, like a business plan, is something we're going to be working on, and make sure that we can recover those costs from our marinas and our campgrounds. The third thing we're looking at is, of course, implementing the local option levy, and lastly, as I mentioned earlier, reducing those barriers to access. As some of you know, the county's working really hard on improving diversity, equity, and inclusion at all levels. And one of those strategies that's really interesting is called Equity Lens Toolkit program. So we have been collaborating with the county's equity manager, and we're actually developing an Equity Lens Toolkit for Lane County Parks. And we'll be able to implement that through the levy. So we're really looking forward to that. And so when we talk about these barriers, not just physical, but also cognitive, cultural, and economic barriers. So being able to address that through the levy funding is something we're really excited about. And I'll stick around, if you don't mind, and answer your questions afterwards. I want to thank the Budget Committee for serving and taking your time out. And yeah, next I think is Kier with the Land Management Division.
Thanks, Brett. Thank you. Hi, good afternoon, everybody, and thanks again for your time this afternoon. So Land Management Division is comprised of 5 program areas. We have our building safety program, code enforcement, coordinated services, land use planning, and sanitation. And we are tasked with administering the uniform building codes, that's performing plan review and building inspections to ensure safety. We administer the Oregon Electrical Code. Our compliance staff do nuisance abatement and code enforcement. And our sanitation team administers the Oregon DEQ administrative rules around on-site sewage disposal. And of course, our planning group administers the Oregon statewide planning program. There are currently 48 FTE in LMD. We are proposing in this budget to reduce that down to 47 with the elimination of a vacancy position, a vacant position. And I will point out that for the first time in several years, as the workload of the Holiday Farm Fire has declined, we feel that this is the first time that LMD has been appropriately staffed in a long time to be able to meet the customer service expectations that we have around processing permit timelines and general assistance to the public. So that's a very positive thing. That said, there are some program areas that are still a little tight, such as our code enforcement team and our electrical inspectors. But I just want to highlight some of the work now that we are what we consider fully staffed up. Just in the last 18 months, our team's been able to reduce processing timelines for basic land use permits from 49 days to 30 days. More complex special use permits, we've dropped the processing timelines from an average of 102 days to 65 days. We've reduced the average residential plan review for a residential building permit from 34 to 31 days. Commercial building permits we've reduced from 52 to 17 days in the last 18 months. I'll also point out that traditionally it would take sometimes 2 or 3 days to receive a call back when folks called for customer service inquiries. We're now returning calls within 24 hours or less. Our average customer wait times in our lobby, which traditionally could be over an hour, are now around 20 to 25 minutes on average. We've also opened up a satellite office in Florence. Of course, these improvements have come with some costs. Increased labor costs and overheads, as Dan had mentioned, have combined with a slowdown this past year in the construction industry, which seems to be primarily driven by those higher interest rates. This is resulting in a proposed operational deficit of $370,000 this year. Although this is not insignificant, I'll point out that LMD has been building healthy reserves over the last several years. And currently, our reserves sit at about 10.5 million. And we are proposing to bridge this gap with the use of reserves, and that's why we've developed a really healthy reserve in land management, because we are so subject to the whims of the construction industry. So the reserves are for just this sort of instance when we're seeing a decline in permit activity. Instead of making deep cuts, which then take a long time to rehire, and then if the economy picks up, we're kind of behind the 8 ball. Our strategy all along has been to try to retain the staff that we have, so we're ready to move when the permit activity picks up. That said, I am holding some positions vacant, and if things do not improve over the summer, we're likely going to propose the elimination of 1 more FTE in the next supplemental budget. Let's see. In addition, as Dana mentioned, we're just concluding an external review of our fees in land management. We're heavily dependent on fee revenue, and we're finishing up this kind of holistic study that's looking at trying to understand the true cost of service for each of our different permit types. And if there are some permits that we are not seeing adequate cost recovery on, we'll be presenting those to the Finance and Audit Committee for some potential changes in our fees. Moving ahead to next year, there are some interesting things going on. This past year, the board adopted erosion control standards, which LMD is in part tasked with implementing. Our team's gearing up and has begun implementing those erosion control standards and is working on the next phases of that, dealing with stormwater. A very exciting thing is our E-Pass program. I presented this concept to the Budget Committee in years past. We called it the Citizen Platform, but it's been a project that LMD has been working with an external vendor on, as well as our technology services team. It's a major technology initiative that's geared at developing a software that will basically allow the public to submit building, land use, sanitation permits online. It'll include a series of guided prompts and other information that'll help the public get through the permitting process. And it'll have an easy way for the public to check in on the status of their permits. As I said, that's been going on for about 18 months in earnest, and staff are just finishing up the testing phasing of that. We're hoping it will be launched by the end of this fiscal year. That'll be the phase one. We basically want to roll it out in a couple of phases, with the more basic and common permit types being rolled out first. And then in the next year, we'll move into some of the more complex, esoteric types of permits that are a little more challenging to program the system in. And also, we want to just really not stumble out of the gate and have it work for the public the first time out. Another key initiative is just to maintain the gains that I've mentioned with our permit process and timelines. There is currently an audit being performed for LMD, and of course, if there's helpful recommendations that come out of that audit, we'll be looking to implement those in the next year. And then finally, we will continue to build on our key performance indicators and dashboards. LMD spent a lot of time working with technology service to build a robust set of very helpful live dashboards that help me track where permits are in the process, funding, staffing levels, a number of different things. And that's in part that, and along with a number of our process improvements, is what has been, and of course, additional staff has been driving that reduction in permit wait time. So we'll be continuing to work on that. And of course, I'll be happy to answer any questions at the end. Thank you very much.
Here, just real quick, you said you had a pretty healthy reserve. Most people are telling me in budget time that a good reserve is 6 months. It looks like you got about 2 years worth. Is that about accurate?
1 year, yeah. Although it said earlier that we decided a $4.5 million, that's just what we bring in fees. We do have other sources of revenue, federal, Title III, and others. So our total resources this year is about just over 10 million. So we've got just about a year of reserves.
Our goal for land management is actually 18 months. And so we've been working to get to that 18-month goal. It's very different than our other divisions, but we're sitting at about a year.
Is that because of the past experiences of the downturns of the economy and the construction business, all that? That's what you kind of gauged at?
Okay. We went through a devastating time where I think almost half the staff was cut, and then rebuilding was super challenging.
Yeah, and at that point, we needed over a full year of reserves, well over a full year of reserves. If we would have been able to weather that, we would have needed well over a full year of reserves to get through that, and then rebuilding was a challenge.
Good, thanks for clarifying that.
Ella, I just will say, Ella, it's a really good question. LMD has spent the better part of the last decade building that reserve, trying to get to that place so that we, if we hit a 2008 type, and that was an extreme example, but I think it was kind of around 2009, 2010 when we saw those big cuts, so that we're in that position. So it hasn't happened overnight. It's taken, nearly a decade to do that.
This is Orrin with Rhodes.
Thank you. I want to echo what Kieran Brett have both said. Thank you to the committee members and the commissioners for hosting us today to talk about our budgets in each of the divisions here in Public Works. I get the privilege of representing the Road and Bridge Maintenance Division. My name is Orrin Schumacher, like Keir said. Let's go over our first slide. For the people who are new, or just as a refresher for those who aren't, what's up on the slide there is kind of our key programs. Pavement preservation is obviously our #1 thing. We want to paint the picture of the volume of work we have in front of us in the Road and Bridge Division. So we have 1,400 miles of roadways. That's a significant road system. That's both urban and rural. So some of the times when you're in the city, those are county roads, and most of the time when you're in the rural areas, those are county roads. So that's key. We also have, as part of that, our bridge program, which has over 420 bridges. So that's one of the bigger asset volumes we have in our system. Part of what we do out there as well is our striping and signage. So everywhere you drive, you see signs that tell you what to do appropriate driving, and also markings on the roads. That's done by our crews on the same system volume that we have. And then vegetation management, it's again managing twice that volume because they're taking care of both sides of the road system. So those crews go through, do all the mowing, vegetation management, tree care across that entire system. And just as a representation of that crew size, it's about 14 people who do all of that work. So significant volume being done by a few people. So that was just kind of a painting a picture of who we are. I did want to hit on a couple of things for this next fiscal. We are asking for an addition of $200,000 in our budget this year for road work supplies. Why that is we've talked about these price increases over since really prior to COVID, but as COVID went through, they escalated over those last 4 years. I want to give a couple of examples. So liquid oil is a product we use as a routine part of our preservation program. It's one of the most frequent materials we apply to our roads. Back in FY23, we were getting that material for about $375 a ton. And right now going into FY with our recent bids, it's $660 a ton. So that's nearly a 45% increase in cost in that short period of time. Asphalt's very similar. Back in 23, it was $39 a ton. This year's fiscal price we'll be paying for that per ton is $53. So again, that's a 30% increase across the board. That's just two of our primary resources. So we have a bunch more supplies. Rock materials are up anywhere from 25 to 50%. And these are just base materials we use, and that's just 3 of probably hundreds of products that we apply to our road system to keep it in shape. So just wanted to paint that picture for you as well. Phase 3 of Territorial Highway, this has come in 3 phases. So phase 3 is the last phase of our jurisdictional transfer with the state of Oregon. It came as a first payment as $5 million, then a $20 million payment. As of July 1st, we'll get the last $5 million payment from ODOT, and we will have that entire 46 miles, I think, or 44 miles of that road system under the county's jurisdiction. If you've ever driven that road, you know that it's not in great shape. We put down in the last 3 years 28,000 tons of asphalt on that just through a patch program to keep it drivable. The section we're about to inherit in phase 3 is probably the worst condition of all the 3 segments over the years. So that'll come with a cost burden that we don't have funding for at this point to maintain, just so you guys are aware of that.
Is the 200,000 increase to help cover that, or is that going to be in addition? We have to figure out where to get it.
It'll be in addition as we work through the capital process, which I'm sure Sasha's team, if we have questions, can elaborate further on. But right now, it's really a maintenance focus to keep it intact until we develop some long-term planning for that. So, and then last, a lot of us probably have not forgotten the ice storm that hit us this last year in February. So I sure haven't, and either of our crews. And so we are working through that. Right now, we're $4.8 million invested from the roads division in maintaining this storm and responding to it. We are working diligently with FEMA. We've applied through the PA system process, and we hope to hear back after, I think the declaration is, all submittals have to be in by the 15th of this month. And so we'll start working with FEMA to do that. Just as an example of cost with that, we just signed a contract with Lane Forest Products for $239,000 to clean up 2 of our stockpile sites. We have 7 of them. So that is fun. So that'll explain the cost that we still see going forward. So 4 is our current. We expect we're going to go up significantly from that as we finish to respond to this storm on that. And then the last thing that we are looking at in our changes for fiscal year 24-25 is our fleet budget. It is one of our most expensive funds within our program. We maintain a large fleet of equipment, and those costs have gone up. An example of our dump trucks is that right now, from the last procurement we made on those trucks, which is about a 10 to 12 year cycle, we're $100,000 more per vehicle to buy them. And that's just dump trucks, and our fleet is significant in size, and we have other large equipment that comes at a high cost. Passenger trucks are up about 40% on average to buy. So every time we look at this new model going forward, we really need to look at the data and when can we rent, when can we shift to long-term leasing, when can we look at other reductions in our fleet program. So that's going to be another one of our big focuses as we move forward through this fiscal year. As an explanation of kind of where we're at in that bigger picture is that we have reserves in our fleet fund of about 1.3 million. Right now, the estimated full replacement in our division on time for our equipment as they're cycled through in their years is 3.6. So we're really minus 2.3 million in our fleet budget as our replacement cycles mature. So it's something that we're keeping a strong eye on and seeing which ways we can cut and improve that program. Key initiatives for us moving forward is obviously maintenance and preservation of our road and bridge system. That is the backbone of what we do. It's what we take pride in. It's the focus of our program. I do want to note one great thing, even though our funding picture is not is where I would hope it would be moving forward with cost increases, is that we were still able to raise our what we call pavement condition index 2 points across our system. So we were at 81, which is a really healthy road system. We went to 83. That is a reflection on the people out there doing this maintenance work that they've made do. They have forecast and they have planned well enough to keep these roads in great shape. So big kudos to the teams that are doing that work. Now the bad news part of that, I don't see that continuing. That is really based on some historical leveraging of forest funds, state highway dollars, SRS monies that allowed us to have investment at a high level into those programs. At this point with the money we have at about $3 million in materials and supplies, we just won't be able to maintain that system at that volume. So I'm sure Sasha may hit on it. We're looking at the transportation package at the state level in 25 and hoping that there'll be some additional opportunities to leverage dollars there. The next one is stormwater mapping and condition assessment. These are all the things that none of us see on a daily basis until waters flood and things back up. This is the underground system that keeps our road system in health, and mainly the urban environment. We do have some in the rural. We are really trying to assess this. We fully mapped our system for the first time in over 2 decades. And now we can assess kind of what the work needs are, what the priorities are, and what those cost pictures are. And I want to paint a picture for the committee and the commissioners is that we don't have a funding source for that work. So our stormwater system, we don't collect stormwater fees. We don't have special utility districts in those areas. So it is an unfunded set of work that we have to look at. And it's going to bear a high cost when we have to end up replacing a lot of that system. So a future awareness for us, and that's why we went through that exercise. And then last but not least is KPIs and data management. If you've ever worked in the road maintenance world, we're still stuck in our, we like to do work, get it done, and focus on that stuff and operations. Data was never our thing. We were still paper and old cell phones and maybe not even cell phones, radios. So we're really shifting into this new metrics of data-driven process. And it's a transition for us. It's mobile applications. It's all of these things that we have to retrain crews, retrain ourselves. But we're really excited because the data is showing us a lot of things where we can improve upon efficiencies, methodologies, speeds, focus, prioritization. So we've gone to laptops now, shocking, right? Well, it's 2024. We're there. And we've got people trained on these applications and we're moving forward. But now we're working with our TS teams and developing these KPIs and painting these amazing dashboard systems that are really highlighting a lot of great things for us to move forward.
Your beeper just went off.
Yeah. Is that my pager work? Yeah, that was funny. I thought it was my timer. So I just wanted to paint a picture, not last but not least, but that is where we're headed. That's our key initiatives for this fiscal year. And I, again, will be available for questions if you have any. Yeah.
I have one question, and I'm not sure if you know this off the top of your head, but I have your section open in the budget, and I had just noticed that in the difference between our current budget and the proposed has a $500,000 increase in federal revenues. Is that for a particular project?
We put it in there in the forecasting for FEMA reimbursements.
FEMA, okay.
And with anybody who's done the FEMA dance before, part of that dance is you don't know what the next move is. So we are anticipating some of those, but we're hopeful we'll actually see more.
Okay.
But I don't like to forecast with FEMA too much in our fiscal with not knowing when their timely payments come.
And as a follow-up to that, the funding that you've expended so far in response has all come out of reserves?
Correct. Yeah, we allocated some monies from other projects over in the first adjustment, and then supplemental 4 this fiscal has another $300,000 ask of supplemental 4 coming to the board here shortly.
And do you have to borrow reserves from another department, or do you have enough in your roads and bridges reserves?
Yeah, like I said, we had other funded projects that we shifted, so there was an HVAC project that we had in the works, so we've moved that money over to cover.
So you have to delay those projects?
Correct. Yeah.
That's unfortunate.
Yes.
Okay.
Yeah, this ice storm is I guess I'm on my 19th year now. It has been the most impactful for our road system since I've been here. So it's definitely coming with a cost burden that we were not prepared for.
So Orrin, do you expect to get all the reimbursement from FEMA, or is it a percentage, and how long? And
It's a 75% is the starting point that they work with you on. Sometimes as you go, you can do expedited adjustments and get 100%. Like I said, FEMA can be finicky. They both start with F, right?
Well, that's why I was asking.
Yeah, and so it is an unknown, but generally the target is 75% reimbursement for most of our activities. Yeah.
Two things. You said we had 7 big piles of brush and we're getting 2. We got a contract for. What's going to happen with our other 5 and how long is that going to take to get those cleaned up for a fire hazard kind of look?
Great question. So we did get some communications with our state fire marshal on the first 2, one of which is at the Parkside at Hendricks Wayside, which was a very obvious feature if you've driven out 126 to the east. You can't miss it. It's a big pile of sticks. So we're working on that one first. They'll actually start work next Tuesday on that, which we're excited about. The other one is the Springfield School District loaned us a property up on Sunderman Road. We want to thank them out loud and on the record for doing that. Allowed us really efficient because it was a high impact area. So minimized our trucking, but had a lot of material. So those are the first 2. The other ones are behind lock gates. So we could prioritize them next. They're at our shops or stockpile sites. So they were a little more protected from public access. So the next step is once we're done with this first one and we get through July 1st fiscal, we'll likely start proceeding with others, or in negotiations with FEMA, we can start earlier.
Great. Then the second question was, I thought it was typical for when you transferred roads, you had to transfer those roads in great condition. Is the road that we're getting in phase 3 from Territorial, are they paying us to take a bad road? Or are we just getting that? Because that's not very typical.
No, yeah, there was some learning with that process. Transfers can be challenging just because there's a lot of intricacies to them. But as that went on, I think we would have asked for more at the time had we been more aware of some of the costs that were bear to that. But that transfer came with $30 million. But I can't remember what that estimate is, but I think our numbers are coming a higher of 60 million to.
So maybe the FTE that you need in the future is a negotiator?
What's that?
Maybe the FTE you need in the future is a high-power negotiator or something?
It also came with getting rid of Delta Highway, which we really wanted to get off of our inventory.
So it's kind of an exchange in a way, for value? Okay.
That was good information to point out right there.
Yeah, get rid of Delta.
There's a section of the Delta Highway, really Valley River Center up to Beltline.
So would you call that a win-win, or is it kind of a win okay?
I'm going to continue it ongoing.
Okay. Fair enough.
All right, well, thank you.
Thank you.
One more, Bruce.
Oh, I'm sorry. Sorry.
You said performance indicator process. Is that what you said?
KPIs, key
No,
performance.
before that.
PCIs.
You went.
Oh, PCIs?
Yeah. Yes, PCS.
So pavement condition.
Yeah.
Yeah.
I thought you said it went up.
It went up 2 points. So all of the work we do, so roads are based on an objective scoring criteria. It's a nationally recognized scoring criteria that's done by inspectors. And so they go out and run our system every 2 years, half the system and half the system, and then it gets ranked based on that inspection criteria. So between slurry seal applications, chip seals, overlays, blade patching, crack seal programs, those all carry a weight to improve the condition of a road. So over those years, this last year, that last ranking raised us 2 points. So in that, we are either the highest in the state or we are right in the top. So it's great to see.
Wow. So what percentage is that road considered gone and just needs to be replaced, like say Territorial?
A fully deteriorated road is anything really focused below like 60 points.
So we're only 21 points away, really.
Yeah, but to drop a PCI point throughout your system is not like, the one pothole pops up and you drop a point. It takes a lot more to lower you than that. But when you look at our funding curves, and I can share that with the board if they have an interest down the road, is we did go out with a group called Capital Assets, which is a private firm that did an assessment of our cost needs. And we put in our budgets and unfunded budgets. And really, if we don't maintain by adding about $5 million a year into our system, we're going to have this arcing curve down over the next 5 to 10 years. That'll drop us into the 70s, and then it's, once you get worse, costs go up. So obviously, if we can stay high, the more efficient we are and the more cost effective.
Slurry chips.
Things, preservation program is key. Yeah.
Thanks, man.
Yep.
Good job.
Thank you.
Thank you, Arm. Very good. Excellent.
And I'll introduce. I don't think I hit the button, sorry.
My name is Sasha Vartanian, and I have the pleasure of being the interim director for Engineering and Construction Services. Thank you so much for all of your time. Thank you, Chair Weber, and the committee members and commissioners. So ECS is made up of 6 programs. We have a lot of complex work that these programs complete. Our ECS admin services does primarily budgeting, contracting, and kind of the day-to-day management of our capital improvement program planning. Design services does the design also houses environmental services, which means our environmental permits for projects as well as stormwater program. And then special districts, which I'll say is one of the groups that is not funded by the road fund. And special districts is really has identified a need of all of our unincorporated communities where there's urban infrastructure that is needed. And so Rob Woodard is leading that program. Construction Services performs our inspections, has our materials lab that does materials testing both for our projects as well as City of Eugene and Springfield and others. And construction administration, so they help a lot. We are certified by Oregon Department of Transportation to deliver federal aid projects, and there's a lot of management that goes behind that to keep our certification up. And then transportation planning, transportation planning leads both long-range and short-range transportation planning projects. They're the group that is in charge of going after most of our grant funding that supports our capital projects. And they also are in charge of administering Lane Code Chapter 15. So that's where if there's a land use action that takes place adjacent to a county road, we are providing conditions for those land use actions. And then traffic operations and design, they operate and maintain our traffic signals, have the electrical group, and then do all of our facility permitting in the right of way. So utilities and driveways and development. And then our survey services, we have a great county surveyor who, under his guidance, has the Corners Preservation Group, subdivisions, construction, and right-of-way. And that all equals about 58 full-time employees. Next. So changes coming up. Not surprisingly, hearing some of our funding outlooks, we're more and more dependent on external funding to deliver our capital projects. So we are more than ever aggressively pursuing grants. We just submitted a $25 million raise federal application for 30th Avenue. And we're always looking for extra dollars to kind of the amount we're using road funding capital improvement has diminished over time. And so we're trying to leverage as much as possible in external funding. With that reduced forecast, with a reduced revenue forecast, that means while we're trying to bring in external dollars, we also are forecasting that we have limited revenue this next coming fiscal year because we've delivered a lot of our revenue comes in when we're designing the projects, and we have 2 large projects going to construction this year, and so those are construction contracts that go out to the contractors. While we bring in some revenue through our inspection services and survey, it's a much smaller amount. And also, we don't have a bridge engineer on staff, and so we rely on consultants for our bridge projects, and we have several of those coming out too. And then, as you've heard, there's continued increased costs in construction. And so, for an example, we talked a lot about Territorial. When we took on that road in the first phase of the Territorial project, Stony Point, we had a rough cost estimate of $1.5 million, I believe. The final cost for that project was roughly $5.5 million. And that was, in the middle of the pandemic, and things have only continued to increase. So we're really trying to stretch our funding as much as possible, and we're trying to right-size what projects we can take on design in-house versus what we need to contract out, and what is the right caliber. So that's what we've been working on. And I should say, part of that comes with, we're also struggling to hire engineers. That's a continued struggle, so that's not really a change to this fiscal year, but it continues to be an issue. So designing in-house, we are also training our engineers that we're bringing on, and that takes more time. I'm gonna work clockwise because we have a lot of initiatives we're working on, and then I wanna end on the 2025 legislative session. So right now we're working on designing 14 capital projects. Those include culverts and bridges, as well as pavement preservation and 2 safety improvement projects. We're putting out for construction 7 projects this coming fiscal year, totaling $16 million. Those include Hayden Bridge seismic retrofits, Good Pasture Bridge, which is fire suppression and seismic retrofits, Row River deep culverts, which has been a project that has been on our books for a long time we're really excited about. And then also 2 large urban projects, so Laura Street as well as Gillum Road. And both of those, we're really excited, are setting us up for jurisdictional transfers of those road segments. So that's a key piece that we've worked on in the urban area, is when we take these urban upgrades on, we're making sure we're working with our city partners to lead to jurisdictional transfer so it gets off of our books. We're continuing to use eBuilder, which is a project management software, and BidExpress, which has allowed us to go paper-free in our bidding of construction projects, and those are helping us again be more efficient with the staff we have. And it's also building in place processes so that if we do have turnover, we have these processes built and people have the instructions to be successful. Then we're continuing to identify grants. So this is the capital improvement project funding. We're looking at the federal level. Unfortunately, being rural and not having a lot of traffic on our roads, it's really hard to compete for the federal grants. But we're trying to be as strategic as we can, and we've seen some successes, including a planning grant for which I'll get to update our safety transportation action plan. We are also hoping to get to a point, we're working on getting to a point where we can again really provide internal services to public works and other departments. We used to be the go-to for all engineering tasks, projects, questions, and we're getting there again, and we're hoping to support parks in the levy. We're also continuing to develop a special districts program, and that will continue on. And we have a new update to our transportation safety action plan, which we're really excited about, and it will allow us to go after infrastructure funding at the federal level once that's complete, because there's certain expectations and criteria you have to meet in your action plan before they'll allow you to apply for the money to actually build things. And Warren touched on this also, continuing to develop our stormwater program in order to meet our permit obligations and then identify and better understand all the infrastructure needs. This program is takes a lot of staff capacity and time, and we're continuing to develop it, and will be an effort over time, and you'll continue to see at the board level code that is related to this effort. So then last but not least, we hear wind that the 2025 state legislative session is going to be a transportation package. We're working really hard to build our narrative of needs. Unfortunately, Oren's team does such a good job maintaining roads and bridges that on the maintenance side, we look really good, but we know we see that cliff that we're coming to. And most of our infrastructure is functionally obsolete. So when you look at needed housing in our small urban and rural communities connecting to each other, there's no shoulders for people to bike or recover if they're driving and have a moment of inattention. So those take huge amounts of dollars to actually build, and that's because we're a towards zero death transportation system policy we're working towards. Those investments are essential, but we're a long ways from them. So we're working on that narrative, but I'll also say we are concerned that this session is really going to focus on ODOT's needs, and we need to make sure that folks realize we have many more lane miles, many more bridges at the county level than the state level. That's what I'll leave you with. Thank you for your time. Any questions?
Any questions?
Actually, thank you, Chair. My question is more on the project level. Stony Point.
Yes.
A huge project.
Yes.
And I drove there yesterday, crazily enough. I just drove out there. I guess I hadn't driven out there for a while because it really is marvelous. And it just doesn't quite straighten it, but it makes it a much more drivable stretch of the highway. And we knew that was happening when we took over Territorial Highway. We knew that it was a very, very dangerous stretch of highway. No longer dangerous. My question is, that took a lot of material. Where does that stuff come from?
The fill?
Yeah.
Well, you have to put clean fill in, so it's the contractors trucking it over there.
Yeah.
And so, some of our local quarries and other places that I couldn't tell you.
You couldn't tell, and we contract all that out. That happens through contract, yes. And so the large construction companies come and do that building. But I remember what it was like, and that road was every year a bit of it slid away. And you drive up there very, very carefully, even in the daytime, because you didn't know which stretch was going to be gone. And right now, it just is a very drivable stretch of one of the most visited parts of Lane County. So it really is pretty remarkable, the work that is done. But I'm always fascinated by, you know, you don't, that stuff doesn't ship from Washington State, does it? No,
Well,
it comes from very local sources.
We hope it comes very local because the trucking costs are also very expensive
Very
and hard
expensive.
on our roads.
Yeah. So every time you send a 20-yard truck up and down the highway, it's rattling the road. And if you send it many miles, well, send it the fewer miles you can send it, the better. Okay, good, thank you.
Other questions?
Just more of a curiosity question, probably not a budget question. I mean, on top of Commissioner Farr's question, at what point does it become not cost effective for distance to haul rock from one place to another? I mean, I'm just kind of curious about that just for the future.
I'm sure we could get a calculator out and figure that out, but I don't have the answer.
Yeah, it's just my brain, sorry.
The strategy is to identify sources
Close.
as wide and as far as you can across the country.
Okay, that's fair, thanks.
Okay, I'm gonna follow up on Commissioner Lovell's question. It's not budget related, but since we're running ahead, so we're good. As far as, what am I trying to say here? Lost my train of thought, thanks.
I'm not driving the train.
You've talked several times about changing, it's a city road, or it's a county road, or it's a state road, and it's switch. What is the criteria for that? Because I have that question all the time, that sometimes there are, well, this must be a county road, but then it's not. Then ODOT gets involved, and is there a 3-minute?
I wish I had the county surveyor here because he could answer it more eloquently, but I can tell you it's when the road is established. So because the county is older than most of the urban growth boundaries around. So we have a lot of county roads, and that's also why we have county roads within urban growth boundaries. You know,
Like Gillum Road you were mentioning,
Gillum
stuff like that,
Road,
sure.
Santa Clara River Road area is the best example of that, where that area was expanded at a later date, and instead of annexing the whole entire area at that point, it stayed patchwork in terms of what is city limits and what is not, which is why we have, you couldn't flip a coin to figure out which section is city versus county in that area.
Oh, good, because that's kind of what I felt too. I can't figure out what's.
We do have maps that can tell you that.
Okay, perfect. Well, thank you for your time, Jess. Thank you. Dan? Oh, I'm sorry.
I just have a question going back to Oren for a minute, if I could. When you were talking about the stormwater system, I mean, how connected is that to other systems? And are there opportunities to leverage with other jurisdictions or entities for a system-wide approach?
I would say I'm hopeful there is. The system is interconnected. So obviously in that patchwork, you have City of Eugene stormwater connecting to county stormwater, private road systems connecting to both. So it is required that we work together. So we do have a maintenance IGA within the River Road Santa Clara area that we've maintained for decades. There was an interruption in the early mid-2000s where we didn't, but it is to share that burden so we all cooperate to keep that system intact, all of our systems intact. It is very
In
connected.
terms of there being no funding source, I mean, if we don't maintain, it impacts the other jurisdictions, so they should have a vested interest.
They would, and the city has stormwater fees, so all the other properties obviously collect stormwater fees. It would be of value to continue to pursue those opportunities.
Thank you. It's a technical term.
Dan?
I would just like to echo my thanks to the Budget Committee for your time today and for your service on this work to our county. We were only able to highlight 4 of our amazing division manager team. There's another 4 that you didn't hear from. Corey Buller with Lane Event Center, Michael Johns with General Services, Jeff Orlandini with Waste Management, and Paula Davis with Admin. And they are available for questions. If you have any questions for those other divisions, we could take those at this time or from the managers in this room. So this concludes our briefing, subject to your questions. Thank you.
Anybody have any addition?
Yeah. So Steve mentioned this in his budget message earlier this week around sort of the proactive effort there was around, I think it was Measure 110 with the county in the short session. And so I'm, thinking about 2025 and gas tax, and, there is definitely rumor that it's going to be a transportation session. Are you all preparing to be proactive, much like you were with Measure 110, around the conversation and really taking a solution to the legislature that would be appropriate for a county road system versus ODOT or city road system?
We have engaged on that. Sasha and her team has already put together a list of talking points that we're trying to engage legislators with. It'll be elevated as a legislative priority. Unfortunately, we're losing Alex Kyler,
I think he might be gone, right?
Yeah, lost, yeah.
Yeah, I think so.
So that's a hole to fill. But Steve Adams is
Yeah.
already engaging in this work. We're reaching out to Association of Counties, and we'll be engaging with ODOT to make sure that our needs are being considered along with theirs. So yes, we are working to elevate that already.
But if I may add, I think the unfortunate thing is we haven't seen a lot of solutions at the state level that are going to percolate into 2025. You know, they've had the vehicle miles traveled study going on forever. They just pulled the tolling from the Portland area. So we're very worried that there's not going to be a solution other than just increasing the gas tax more. And so we are looking at, we're trying to like evaluate what would make sense at the local and county level.
Yeah, I think that's smart. Yeah, good, thank you.
Commissioner?
Thank you. I have a question for Brett or Dan. Our parks fees, what do we use as comparators? I mean, in some measures, we're comparable to state parks with the campgrounds, but do we use our other counties? How do we know our fees are where they should be?
Yeah, so we haven't raised fees since 2019, right? And the plan all along was to look for more sustainable funding and not, tax or basically say, okay, the people that are using the parks, we're gonna start raising the fees. When I mentioned cost recovery earlier, we're gonna take a look at that in more depth. So what we're gonna look at is the comparator counties, like Lynn County, Douglas, and some of the others, Jackson County, and make sure that we're at the market and where the market is. And then what we wanna do is take a look at CPI and slowly increase to make sure that we stay up to the market level. But even the fee, as we've seen over the past, 40 plus years, that the fees are not going to sustain our services. So we need to take a look at efficiencies and other things as well. And so I'm really excited about doing the KPIs, the performance indicators, and taking a look at our services and how we're recovering and basing that on some of those fees.
Other questions? This is our time. They're all here.
I'll just say that I have it on good authority that our marinas are pretty good value for the people using them.
That does get to what Brett means by cost recovery is, trying to recover the cost of that service and making sure that's equitable. So, seeing which services we sort of subsidize through TLT and what's the other one? CRT, thank you. And which should we really be the burden of the person benefiting from that service? So marinas, that's really personally benefiting the people that are using those. So we want that to be less subsidized than something like a daily pass to Mount Pisgah.
But when our marinas have like a years-long waiting list just to get a slip.
At some of them, but then at Orchard Point doesn't fill, so it depends on the location.
Yeah, with the water levels, it doesn't fill. So
More like it's good today.
Yeah.
All right. Okay. Anybody else? Thank you, Dan, and your group.
Thank you.
Thank you.
Good job, Corey.
You get a 3-minute break.
All right. No, let's take I've had to sit up here with you, sit in the back every once in a while.
This is beautiful. Well, it is, and the people who use it believe that. I guess they pay their rent. It's true. It's really aggravating people who want to.
Did they warm you up?
They did.
Hi. I'm sitting here.
Wherever you are. Either one. Yep.
To just push the down arrow to go.
Okay, thank you.
The slide operator.
Slide up,
Yeah.
see.
We're the last one presenting today, is that right? Okay, sorry.
Correct.
I have a good amount of information, but I'm not gonna read every slide. I think most of you are pretty seasoned with assessment and taxation in this presentation. I have added some information, just to sort of maybe have a different type of conversation. And I just really am not gonna read every slide to you all. Hi. So, but I do have a lot of notes. So interrupt me if you have questions, and we're gonna start early. Is that okay with everyone?
Absolutely. I think we're all here. Let's go for it.
Great.
So thank you.
Okay. Yes, thank you, Chair. Congratulations, by the way.
Thank you.
Yes. Okay. I'm Mary Vuxit Schaefer. I'm the assessor and tax collector for Lane County Assessment and Taxation, and I'm presenting our fiscal year 24-25 budget. So, there, that's me. Okay. I have notes and slide notes. These are shorter than these. So, our department, essentially our department overview is to appraise property, calculate, collect, and distribute taxes to 85 different taxing districts. And we have 3 divisions: administration, property tax management, and appraisal. This is one of our favorite graphics, and the cents per dollar, or for every dollar, they change every year depending on if there's a local option, if a bond has sunsetted, or say, for example, something doesn't pass that is up for renewal. So the cents where they go to what district will change. And then these are district categories. They certainly do not capture all 85 different taxing districts, but those taxing districts fall within these categories. Questions on this? Okay, you're all pretty seasoned on this one. So our resources are, general fund is where we get most of our money. And CAFA grant, which I'll get into on the next slide, that's a state grant. Tax foreclosure and late filing penalties. We get a little bit of money from housing, Oregon Housing and Community Service fees. That's the ombudsman fee for manufactured structures. We sell some data, we get a little bit of revenue from that, and then application fees. So, yes. Our CAFA grant, it was created in 1999, and the idea at its inception was to fund assessment and taxation 30 to 40% for all counties statewide. It was not indexed to increase with inflation. It is based on, there's 2 main funding sources. One is recording fees and the other is delinquent interest. And recording fees, we all know, are subject to what's happening in the market. Right now we're seeing a pretty flat market. So recording fees they're not really moving the way they were a couple of years ago. So the state general fund contributed $5 million to CAFA and then eliminated that in 2009-11 in their biennium. So this year we are hoping to, or this next year, we're hoping to get $925,000 from CAFA, roughly 11.3% of our expenditures. We apply for this grant every year and have to, meet some staffing requirements and say that we're doing the function of the assessment taxation office that we're charged to do. And then we have, this is kind of a breakdown of penalties and fees. We have a $40,000 internal transfer fund, and that is, we have a software replacement fund that we've been putting into, and the general fund has also contributed to over the years. We have a computer system that was installed in the 1990s. It's old. Think about if you had an iPhone from then. You wouldn't have an iPhone from then, right? So we're trying to squirrel away some money to replace that system. The $40,000 is to help us with resources to create, sort of applications that can support sort of more robust features that we need to do. So we're kind of just paying ourselves out of this fund. So, but I need to call it out because this is a budget meeting. Yes.
Make some money off data sales?
Just a little bit.
Just a little bit.
Little tiny bit. Thank you for, actually, thank you. We haven't done a fee review in about, I'm gonna say since 16 or 17, maybe 18. So actually in June, we are presenting to the Finance and Audit Committee to see if they would then recommend us going in front of the board and having our fees looked at and maybe increased. So, yeah. I didn't include that though, because we can't assume that change is going to be, approved by the board. So I just thought I'd also say that. Any questions?
And you said that was what, Commissioner Seneca, add change?
Data sales.
Data,
sales,
yeah. Like we sell our tax roll. That's kind of, like all the information that is on our tax roll, we sell it, so.
But you do a lot for free too. You do, and I witnessed some of that yesterday, which I'll talk about next Tuesday.
Okay, thank you. So this is a new slide for us for this group. And I'm gonna go to I like this slide. Sorry, folks. Just give me a second. Slide 6. So the property tax base is the single most important asset in a district's portfolio because it is a stable and mostly predictable revenue source. Investing in this asset is more than return on investment. It's ensuring quality and quantity of our people, data, and services so we can continue to provide a reliable income stream for public benefit. So I wanted to capture what we're doing, right? So we have 190,000 plus or minus tax accounts. I say plus or minus because every day we're creating and sort of taking away tax accounts. This last year, all this data is certified. So $97.8 billion in real market value. That's a big asset for this county and for all the districts, right? Everyone gets a piece of that. Yes, essentially. I had to sort of get there. $41.1 billion in taxable value countywide, $695.8 million in certified tax, and then $51 million of that went to the general fund, or at the end of the fiscal year, that's the hope, is that that'll go to the general fund.
What is certified taxes mean?
Certified tax, so that is what, that is everything we do in the year, we are working towards certification. So when we certify the tax roll, we are certifying our values, the tax amounts, and that happens in October, right before we send out the tax statements at the end of October, and then tax statements or payments are due November 15th is the first trimester payment. And then there's trimester payment in February, and then one in May.
And that's all properties, industrial, commercial, residential?
Correct, yes.
Okay. Oh, Mary?
Yes.
So we kind of talked the other day. What do you think is really out there as far as we have 97.8 billion in real market value? What do you think that number really is?
That's a great question. And if you give me like 15 staff over 5 years or 3 years, I'll tell you what it is. Here's the thing. I wish I could answer that question. It's a great question, and I think that is the question, right? No. We have a study from the University of Oregon grad school. Last year in June, they presented to the board, and their findings were that due to our staffing levels, we are leaving money on the table. So they kind of extrapolated an amount. I tend to think it's more, and I can get into that data. I didn't actually come to talk about that data specifically, just to give a pretty high level. I'm happy to. I know that in May, 16th, there's an opportunity if you all want more information or if you want me to email Christine, I can do that. So sort of think about that.
And it's one thing I would just maybe add real quickly is that we've actually pitched to the cities and the school districts as well as to the legislature to say, hey, particularly for the cities and the school districts who would benefit largely from the additional value, if you pay for some additional appraisers, we can go out and do more work and get more value for you to generate more revenue.
Yes.
But they have not taken us up on that.
Right.
But it's also something we've talked to the legislature about and you're actively working on to say, you know, if we actually have more resources to hire more people to do more appraisals, we can collect more resources to distribute to the taxing districts.
At the same time, you know, if for example, you know, there was 5 more appraisers hired, or, you know, we'd have to balance that with specialists and accounting clerks because they can't generate more work and then have the other division, you know, we have to be staffed up in both divisions. But, you know, we could, if we wanted to track that, you know, and then we could say, this is the actual return on investment per property appraiser, you know, it can be done, we can get creative with it, so, yeah.
So this is more of for the board probably than the budget committee, and maybe we or Marie can talk more, is, you know, what could we do? How could we commit some resource, and where would it come from, to do a real study, a cost-benefit analysis, and how long it would take to catch up and recoup the additional expense of new hires to help make the case to our jurisdictions that are benefiting from us performing this service without a cost. I mean, that, you know, we've got to spend some money to make the money.
Correct.
So I'm not sure, Steve, this is really a question procedurally for you. How might we go about doing that work? Is that a board assignment? Is that, do you even, you know, and I recognize if you're already understaffed and that takes staff from your office to do that kind of analysis, that's a kind of a catch-22, but every year we go through this and it seems a real opportunity. What do we
It
need?
does feel a little bit like Groundhog Day because we did it with the prior governor and administration, and we tried to get, you know, all the county administrators and assessors came together and said, can we get, you know, can we get a bill in the legislature that will fund? The issue is, it's kind of complex, but, you know, the school districts don't really care so much because they're going to be made whole, right? If they don't get the local taxes, then the state, so they don't really, they're not so much interested. We felt like the cities are the ones that really do have the most to benefit. The state doesn't, I mean, frankly, the state just doesn't really care when they're looking at issues of concern statewide. This isn't an issue that they're primarily, so we've sort of pitched these ideas and tried to, and it just, they have not gotten traction in prior legislative sessions. So it's not to say it's not worth an effort to do that. Yes, we could look at doing some kind of assessment. I think there is strength in numbers, so looking at like what are the other assessors and counties that we would come together on, maybe to fund a joint study that we could then take to the legislature and make a pitch.
Yeah, I mean, it's been a priority at AOC every session as well. So, okay, I didn't think about that some more. I have a thought.
Thank you,
I have a
and
thought.
I'm so glad. So this is the conversation I was hoping that we would have today. And I have some more to add on that. Yes?
Well, okay, before we go forward, on top of that question too, is if the state's not really interested in helping us out with really finding our real market value, would this be a situation where the county act as a leverager of maybe some reserve money for a certain period of time to invest in hopes of a projected ROI back to repay the money back into the reserves? Is this something that Lane County could act as the bank to get this going first, because it would be the quickest way of doing it?
That is for the board.
Just put that out as an idea.
The thing that I don't,
That's a great idea.
philosophically, it's like, why is the county using its 12 cents on the dollar to subsidize what the 88 cents that gets distributed to everybody else? But maybe there's a legislative thing to say, hey, listen, for every additional dollar that the county puts into more appraisers to add more value, we get to collect that. That if there's additional value that's generated from our work, do we get 100% of that until we recover? I don't know.
Yeah.
So there's maybe some things
Like a
we could do
special
on the
project
legislative
fund.
front to say, to incentivize us to make that investment.
I guess my only comment was, we'd be a year ago talking about the same thing because we were waiting for the legislature to take action when every year we're going to be further and further behind the eight ball. I mean, at some point we need to take our own problems as our own solutions.
Well, I think maybe we're getting a little far afield, but I mean, there's also, the CAFA grant structure itself is something the legislature could fix.
True.
And so I think it might be a couple of different avenues of approach. Working with city partners here within Lane County is one, and then working with the ledge on the formula funding that hasn't been indexed and hasn't changed in far too long. Maybe a more compelling case at the state level.
Yeah.
But it's been a couple of decades since I was in the legislature, and it was an old conversation then.
Yeah.
And 1995 was when Measure 5 passed.
That's why they keep electing younger people to
So
and then when we're old,
remember.
we'll be like, oh, this one, yeah. So,
Remember back in '95?
I know.
Measure 5 passed.
I want to, so sort of in this realm of conversation, the Department of Revenue in 2022 took the CAFA grant information from all the counties and compiled a staffing model based on the number of accounts per county. So here and lower is 2022-23 data. I included 24-25 and put our FTE in, and we're at 66% of the modeled or the recommended staffing from the Department of Revenue. We're at 48 FTE this year. The 0.9 is due to Board of Property Tax Appeals and foreclosures. So for our grant, we have to include that FTE, but that gives you a good sense of where we're at. And then our comparator counties, Washington and Marion, are at or exceed 100% of the recommended FTE. And we are, we're just lower in FTE. If you look, Deschutes County has fewer, but they have far fewer tax accounts than we do, and so is Jackson County. Washington County is larger, but Clackamas and Marion, we have more tax accounts than they do, and we're way below them as far as FTE. So this also sort of illustrates that point, right? But I wanted to add this year to sort of change up the conversation. Does anyone have questions about this? Yes.
Do we know how Washington and Marion are funding those additional FTE?
General fund. Yeah.
Base rates are.
Okay. So our expenditures, wages increased sort of the natural expected amount, and also this last year we had pay equity increases for 11 different people. Those are not, I say people because it's based on their education and experience, and 2 people, let me go to my notes real quick, 2 people out of that 11 had a 1-step increase and the rest had a multiple step increase. So our personnel expenses increased a regular amount and then also more because of the pay equity increase. So I just kind of wanted to point that out if you see a big increase there. You all know we're barely meeting minimum statutory requirements and staffing is far below optimum levels. We are reducing by an FTE this year, and that is a person, that is a filled position. And we're reducing in M&S. I think most notable in M&S that will have the biggest public impact will be the fact that we can't afford to send out trimester reminder notices. So that's about 15,000 reminder notices sent in January and then sent in April for the 2 trimester due dates. That's a big postage cost and it's not mandated. So we thought, well, where else can we pull from so that we don't have to reduce FTE anymore? So, and then there's other like licenses that we're sort of paring down and office equipment, outside education and travel, that type of thing. Commissioner?
Do we not have other forms of contact information that we could be sending reminders, text reminders, email reminders?
Well, we don't track phone numbers. So I would say yes, maybe not those ways. We are gonna work, actually we're starting, Krista actually scheduled meetings today to talk about what our tax insert will look like in the fall. So, could that be longer with, maybe like the reminder coupons with that fall statement, something like maybe a sticker to put on your calendar, although I don't know who has a paper calendar but me. We can use our social media, we can partner with Devin to really get the word out. Are we still gonna upset some people who rely on that?
Sure.
Absolutely, yeah.
And are we gonna miss any revenue from that?
Yeah, that's what I was wondering, if you missed some.
Well, the revenue that we will miss will make up an interest, which is not good public, it's just not good public relations. We're so lean. I don't know how many of you know this, but in 11-12 and 2012-13, between those 2 years, we eliminated 14 FTE and we've recuperated 1 and grown by 20,000 tax accounts. So we're lean already and we're kind of even leaner. So does anyone have questions about this? Okay. So the administration is really, we're there to support property tax management and appraisal, doing all the administration things. I'm cognizant of time. I know some people have 4 o'clock appointments, so. One thing that I really want to pull out here is stabilized funding that we're working with the Osaka and OACTC, that's for assessors and tax collectors, the association, which actually just merged, but for the time being, we're just living together, we're not married. So we're just feeling it out. So we are partnering with Rep. Nathanson, and she in the short session, she appointed Rep. Smith, Republican from the east side, Nathanson. They work very well together. They're both on revenue. And she appointed him to chair a committee to get with the districts, the assessors, AOC, LRO, everyone, to say, what is the plan, the legislative fix for stabilized funding? So Rep. Smith, I don't know if any of you know him. He's he gets things done, and with Rep. Nathanson, and they, so we have some new momentum, which is nice. Rep. Smith really understands how crucial our work is, and that we being a state, we're leaving money on the table, and we could be funding our services more robustly. So,
cool.
Okay. Property tax management. So I like to say that all the work sort of begins and ends in property tax management. It begins here, it goes to appraisal, and it ends here. It begins here with deeds that we process through name changes, any mapping changes. They start in property tax management. A lot of our customer service, frontline first contact starts here, and then the work, gets assigned to appraisal, to inspect and value, and then comes back to property tax management to send out the tax statements, collect and distribute all the money. So. And we, just so you all know, we used to use a lockbox service, so we used to kind of outsource our payment processing. And I think 7 years ago, 3, 4, we moved it back in-house. So now we do all that payment processing in-house and don't have to pay for someone else to do it. So that's good. Property tax management key initiatives. We have a robust onboarding program. We continue to update our website. Something that has really been a good collaboration with other departments in the county is this new district formation. There are Pleasant Hill Goshen merged and created a district. Rail River's on the ballot to create a district. All of these are huge undertakings by lots of different departments in the county. So our department and Danny are really key in helping with the boundaries, the meets and bounds descriptions, the value, what would the value be if we merged, and all these properties. And it's a lot of work, and this is also an unfunded mandate. But if we can get this, if we can help this process be more efficient, it's better for us in the long run, and then we sort of have an idea of the work that's could come in from these district formations, and so. And then appraisal. So appraisal, they go out and appraise property. They do that based on permits, owner request. If there's an act of God, meaning there's damage to a property, they do the appeals, they do a portion of the appeals, property tax management does it. So there's this balance between the two divisions that, one can't take on more work or create more work for the other division. We have to balance that FTE as best we can and that workload as best we can. And we have 21 FTE in appraisal. And ratio report, sales data analyst. If we had a couple hours, I would talk to you about every single thing here, but you might fall asleep after your long day. I think it's very exciting. So this is kind of just a brief overview of some of the things we anticipate doing this next year. About 5,000 to 6,000 property inspections, boundary line packets to process, and that can include anywhere from I estimated between 2,000 and 3,000 tax accounts that we manually touch in each division. So we create the tax accounts and then we value the tax accounts. And there's more to it than that, but that's kind of just to give you kind of an idea of the volume of work that we do just in those. And we also have property value appeals. And we're looking at about 26 magistrate cases. Those are mainly commercial and industrial properties, so pretty high dollar value appeals. And then changes, well, I suppose that a lot of these changes are the same because we don't have capacity to take on a lot more, but we're holding the line. We are focusing on safety. We have a department-wide onboarding program, which is great. We continue to enhance our website with manufactured structure information. We're gonna have a tool up probably in the next few months that is a new construction estimator. So a lot of times people say, well, I'm gonna build a house and here's where I'm gonna build it, how much are my taxes gonna be? And now with this tool, we can say, well, you can go online and put in the account number, put in the dollar amount that you're going to spend. It will pull in the existing value and sort of calculate a tax amount based on certified data, because we can't guess what levies are gonna pass and that type of thing. But there's a disclaimer and all it can help the person at least get a little closer to a tax value. So that's great. Sketch project cross-training. A lot of people don't have any idea what I mean when I say that. For each property we have in our database, the idea is to have an outline of the footprint of that building or that improvement. So that's what that is. We're doing a lot of cross-training with property tax management and appraisal to get a diagram for each building in this county. So that's a big lift. Our tax insert is available in multiple languages. And then we do an annual SAL report, so summary of assessments and levies. They're available on our website, and they go through, they break down all of every district, how much money we bring in, our exemptions. I think I've said robust 3 times, I apologize. But they are, and we're rewriting that to automate that so it's less of a manual process. It takes a lot of time, and some of the code needs updating, so.
Okay.
Everything we do supports a strategic plan. I can read all this if you want me to.
And it says robust up there too.
That's the word of the day, Bruce. One thing we are doing that I skipped over is we are collaborating with Clackamas County, Wasco, and Yamhill. We are all on the same sort of archaic software program that is now on its 4th vendor owner, so 4th or 5th. So they don't want to invest in this old code. They're kind of over it. with legislative changes that we have to adopt our code to, it takes a long time to get them through R&D and to implement these new changes, for us to test them. And so we are doing a multi-county RFP for new software. That is not part of this budget. That would be a separate conversation. So yeah, hopefully that will, bring us into this century once we get there. So, yeah.
That's
It's true.
I understand.
At least to the cloud, right? And then these are challenges and opportunities, I think. Yeah, one thing I didn't talk about is retention of our institutional knowledge. We're really focusing on documentation. I think in the last 5 years with our turnover, what we've seen is knowledge goes out the door. I know that you can't document all of that, but you can get close. So we're really trying to pinpoint specific areas and just have it all written down. So, yeah. That's
Thank you, Mary.
all I have.
Thank you.
Yeah.
Best report. Excellent.
Questions?
I have one question. Again, it's similar to the last presentation. I have your financial summary open in the budget line item. And there's this item under resources and interdepartment reimbursements. And last year it showed a $5.1 million investment, and then it's gone this year. Do we know what that is?
That's the ARPA spend down. You will see that in multiple general fund departments.
Well, I would not have associated that with this department.
That's because we have put it in general fund areas. So, because we're spending down the ARPA in this year. And so it's in the sheriff's office, it's in the DA's office, it's in A&T. It's in places where discretionary general fund would have been in order for us to spend it down. So that's how we're now having a sub-fund of general fund.
So was it allocated as ARPA money to A&T, and now it's
Provision of government services is what it was allocated to. And so we're looking for areas across the county. And some of this is in transition, and it came in supplemental 3, is where it first came to the board. But in supplemental 4, we'll look again to make sure we're going to spend down the ARPA. So it's anywhere there's personnel expenses being covered with discretionary general fund.
That we
We've
use
substituted in ARPA in order to spend it down this year because of the federal government potentially pulling it back.
Well, I know we want to spend it for sure.
Right, yes, yeah. So that's how we're
didn't know
doing
what
it,
was.
because
Okay.
personnel expenses is the easiest. Yeah.
Okay, thank you.
Yes, yeah.
Thank you again.
Thank you again.
Thank you.
Thank you, Mary. Great.
Yeah. Have a nice day.
All right.
Yes.
That's it.
We adjourned?
We are.
Oh,
Unless you want to stay around.
Oh, good. Well,